I'm Elaine Reyes at the United Nations headquarters in New York, and this is UN Insider.
Coming up.
We need to address a variety of sectors in order to effectively end TB.
Efforts to eradicate diseases that pose threats on multiple levels.
People that live in poverty are at higher risk of developing TB disease, but also TB disease is a cause of poverty.
And measuring progress toward the goal of health and well-being for all.
With the current treatment that we have, nobody should be dying of HIV.
A conversation on public health in the Americas. Next.
The United Nations is working to end epidemics of a number of communicable diseases by 2030. Health officials believe battles against AIDS, tuberculosis, malaria, and several tropical diseases are winnable. But there is work to be done to increase awareness and rates of treatment and prevention. For instance, every year millions contract tuberculosis. It is the world's deadliest infectious disease, despite the fact it is preventable and curable. On this episode of UN Insider, I sit down with Dr. Monica Alonso for a look at where things stand in the Americas. She is chief of the Pan American Health Organization's HIV, Hepatitis, Tuberculosis, and Sexually Transmitted Infections Unit. Dr. Alonso, tuberculosis rates around the world have actually decreased, but it is still causing more than 1 million deaths every year. It's a major problem in the Latin American region. What is being done to sort of shift that and change those numbers? The TB response requires a multisectoral approach, and we are recommending and working with countries on a paradigm shift. And to summarize it in 3 elements. The first one is not going after the TB epidemic, but doing active case finding to find the cases earlier and more timely and put them immediately on treatment. And for that, we have innovative tools such as portable X-ray machines supported by artificial intelligence that can screen people, and with a rapid diagnostic test, immediately that person can be confirmed for TB. These innovative tools, you need the second pillar, which is information systems. And so countries are working also to shift from paper-based to digital health systems. And those health systems can help with identifying hotspots, certain geographical areas such as slums or neighborhoods where people live in poverty, or certain population groups, right, to focus the efforts. We are also promoting the third element, which is prevention, which is preventing and working on latent infection. So identifying the contacts of persons with TB and putting them on TB preventive treatment. But it's not only about taking the medication, because as we know, TB is a social disease. So you need to have a person-centered approach. On one side, not looking only at the disease, but addressing, for example, all of the health needs of the person. If the person is also living with HIV, if the person has diabetes, if the person is has mental health problems, or has substance addiction, right? And all the social protection package that will help a person achieve a successful treatment outcome. For example, nutritional support, or conditional cash transfers, or also community health workers that will support that the person can remain adherent throughout the whole treatment. We need to work with ministries and sectors of justice, of labor, of education, civil society, academia, private sector, because think that TB is a disease of poverty, it's a disease of overcrowding, it's a disease of barriers to healthcare, it's a disease of malnutrition, right? So we need to address a variety of sectors in order to effectively end TB. Can you explain for our audience what you mean when you say this is a social disease?
Well, the first thing that comes to my mind when we talk about being a social disease is the link between TB and poverty. People that live in poverty are at higher risk of developing TB disease, but also TB disease is a cause of poverty because people do not feel well, they might lose their work or they might not be able to go to work, and they also may face several barriers to access to the health services that they need to be able to be successfully treated. We actually have a goal for ending TB that includes not only reduction in incidence and in mortality, but they call it zero catastrophic cost. And that means that households should not face any reduction in their annual income because of TB. And a catastrophic cost is when a family with a person with TB loses more than 20% of their income. And there are studies in our region that show that half of the families that have a person with TB, around 50 to 60% of those families, will have a loss of 20% or more. And in those studies, we're seeing that maybe they lose 20%, 30, 40, 50, up to 70% of loss of their income just because they have TB. So there so the link with poverty is very clear, but also TB is linked to to equity, right? To populations in situations of vulnerability, indigenous populations, persons deprived of liberty, persons that live on the streets. There's different groups of people that have higher burden of TB. So it's also a question of inequalities, of inequity, and it's also related to economic productivity and economic stability.
And to the economic piece of what you're talking about, people are unable to work, the symptoms and the length of time it would take for them to even feel well enough or be treated to go back to work.
Exactly, yes. Treatments take several months, and people can have different signs and symptoms that, and also think about in our region, a lot of the people are in the informal labor sector. And so if they're not able to go to work, they don't get paid. So if they're not feeling well or they have to go to the health system to pick up their medicine, then maybe that day they cannot go to work. So they may have to choose between having enough money to put food on the table or picking up their medication.
This has been a major problem in prisons in the region. Can you explain to us what has been happening and what's being done to try to address that issue?
The reasons why it's so important in our region is because the Americas has had the fastest increase in prison population in the last decade of the world. And also 2/3 of the prisons are subject to overcrowding. And so you have overcrowding, you have issues about nutrition, malnutrition in this population, and the stress. All that is, let's say, a little bit of a magnet for the development of TB disease. And this affects not only the persons in the prisons, this affects the people that work in the prisons, this affects the families that visit the persons in the prisons, children in the prisons, and it affects the broader community. It is very much a human rights and a public health issue.
Coming up,
There's still a lot of stigma and discrimination towards persons living with HIV.
UN Insider.
Each day, there are millions of stories. Each one can open new perspectives, new possibilities. Wherever you look, we are there to see, discover, explore. We put the pieces together to find what really matters to you, all around the world, all around the clock. Our reporters are at home across the globe. From our headquarters in Beijing and production centers in Washington, Nairobi, and London, China Global Television Network. Stories from across the globe, reaching people across the globe. CGTN. See the difference.
Health officials believe we are closer than ever to ending the HIV and AIDS epidemic. But there are hurdles to overcome. In Latin America, some of the progress made has slowed. Let's continue my conversation with PAHO's Dr. Monica Alonso.
There is a women's prison in Colombia's capital where TB rates are 26 times higher. What is the biggest challenge, especially, we're talking about the majority in the region impacted are men. What about the impact on women?
That's a fantastic question because women, for example, when they are in the prison, they are subject to greater stigma and discrimination. When men are in prison, many times families go to visit them. When women are in prisons, they are usually alone. The family does not go, and even when they get out of the prison, they are also subject to greater discrimination. So it is a very difficult challenge for women overall being in a prison setting. But with regards to TB, the situation is very similar, right? The thing is that there are limited budgets, and we now have these new tools. For example, these fantastic portable X-ray machines and these new rapid tests, but they're still not available in all places. So we're relying on signs and symptoms, and many times these signs and symptoms often go overlooked until the person is very sick and there has been a lot of transmission in the prison.
What would you want the international community to know more about tuberculosis?
We have the targets and we are aiming to end TB. We have the tools. We need to increase the political commitment and the funding. The funding has decreased since COVID. It decreased, and it has been following a positive trend, but we have not gotten back to pre-COVID levels of funding for TB. And now we have all these new tools that, of course, you need an initial investment. But investment in TB is worthwhile because for every dollar invested, you can get $40 back on return from your investment. So it is crucial for social development. And so it's a worthwhile endeavor.
Globally, HIV is down 51%, but not in Latin America. It's one of several regions where new infections have increased. About 2 million people in LATAM right now live with HIV, hundreds of thousands in the Caribbean area. Tell us about PAHO's efforts at the moment to advance HIV response in the region.
Well, as you mentioned, new infections have an increasing trend, right? We haven't been able to change that trend and much less get to the low targets that we want to get to end AIDS. And for that, we have one priority. Well, we have many priorities, but we have the priority of combination prevention. And within that, it's PrEP, pre-exposure prophylaxis. It is a medication that can be given orally, but we need to increase the provision of PrEP, and we need to increase the demand. In places where PrEP is available, there's still not enough people interested and knowledgeable and accessing PrEP. So the target is to have 2 million people on PrEP. That is in the region. And right now we are about at 180,000. So we have a long way to go. The countries are making efforts. There are public policies for PrEP in the majority of countries, but still the number of persons on PrEP is insufficient to make an impact in changing that trend of increasing new infections. In addition to the new infections, we have the deaths. And you have to think that with the current treatment that we have, nobody should be dying of HIV. But we still have a significant number of deaths. We are decreasing the number, but there are new tools that are enabling a faster and easier access to diagnosis and treatment for opportunistic infections and those people that arrive late to their diagnosis or that abandon treatment and then arrive already very sick. And so in order to prevent further morbidity, illness, and mortality for the people not to die, we have these new interventions that PAHO is working on with countries to implement. And in addition to addressing the people that are already on advanced HIV situation, we have the rapid test, the self-test that countries are using, but that needs to be expanded so that people can be more autonomous and be able to do an HIV testing in the privacy of their own home. Because as we know, and that is another barrier that we still have to work on, there's still a lot of stigma and discrimination.
And is that why we're still seeing some deaths today, is because of the access and the stigma allowing the disease to grow?
Exactly. So what happens is that sometimes people are not diagnosed and they're only diagnosed when they're very sick. And so their probability of death increases, right, when they're extremely immunodeficient. But also some people have been diagnosed, have been put on treatment, but you need to take your medication every day. And sometimes countries are providing the medication in a way that is burdensome to the individual. For example, in some countries, they still have to go every month to pick up their medication or every 2 months. And so we are promoting to implement something that we call multi-month dispensing. So persons can have their medication for a longer time. They still take it every day, but they don't have to go to the health services so often and not disrupt their normal life. And so in that way, they will be able to maintain their treatment. The other group of people that arrive with this advanced immunodeficiency is persons that were on treatment, that stopped their treatment because life occurs, right? Things occur in their life that for whatever reason, they stop going to the health services and they stop taking their medication. And then after some time, they may develop an opportunistic infection. And so that's how they get back into the health system and health service. But the idea is to prevent this and not only treat it, but to have people continue on their medication lifelong.
What are some bright spots, any success stories with certain countries where you have been seeing real strides where HIV is under control? There have been huge improvements in prevention and in treatment.
Well, we have some good examples. For example, in PrEP, we have what is called teleprep. Brazil has been advancing so much on PrEP provision, and they have the target of at least 3 persons on PrEP for every new diagnosis. And in some municipalities, in some states, they have been implementing these novel ways of delivering services that protects the confidentiality, the privacy, reduces stigma. And so I think that is a very good innovation that other countries could replicate, right? This teleprep provision. Also, during the COVID pandemic, to not interrupt the provision of antiretrovirals, some countries implemented delivery of antiretrovirals to the person's home or through the community through civil society organizations or through peers. And those are also good practices that we should keep on doing to improve the barrier, to reduce the barriers to health services.
UN Insider.
Introducing CGTN Now. Find award-winning documentaries and exclusive content from around the world. Latin America like you've never seen. Breakthrough films shining a light on important stories. In-depth discussions with fascinating people. Giving you new perspective on topics that matter. You also get live, round-the-clock international news and headlines, and so much more. Original content from CGTN's Global Bureau. Download the CGTN Now app and find the global perspective you've been missing. Available on Apple TV, Roku, and Amazon Fire. Or go to cgtnnow.com on your tablet or mobile device. CGTN Now. See the difference.
The Pan American Health Organization is working to end 30 diseases and related conditions in the Americas over the next 5 years. Dr. Monica Alonso outlined the Elimination Initiative as we continue our conversation.
I'd like you to tell us about Bajo's Elimination Initiative, which aims to eliminate more than 30 communicable diseases and related conditions by 2030, 5 years from now.
Yes, this is one of Bajo's flagship initiatives, and all the Department of Communicable Diseases were all involved. And the first element is having the political commitment. And so now many countries have ascribed or have even taken as their own this elimination initiative. For example, Brazil, Colombia, Panama, Guyana are all embarking on this commitment to eliminate the diseases. Of course, they adapt it to their own context and situation, but it is a way to be more effective and accelerate progress, because before we addressed each disease in a vertical and separate manner. Now we look at all these cross-cutting opportunities. For example, addressing health workers, addressing the first level of care, promoting integrations, because the person is the same one. Just like the elimination of mother-to-child transmission, you include HIV, you include congenital syphilis. Now we're including hepatitis B, we're including Chagas. So it is a whole range of diseases that can affect the same mother and the same baby. So that is a much more effective way of achieving these elimination goals.
You mentioned syphilis. That is a disease that we seem to not hear much about, but it is also a growing issue in the region.
Yes. Syphilis is one of our top priorities right now. The region of the Americas has the highest burden of syphilis worldwide, and it is increasing. It has increased about 30% in the last 5 years. And this is very important because it is affecting all different population groups, right? And if it affects the pregnant woman, it will cause congenital syphilis if left untreated, and that is an extremely important adverse outcome. The baby can it can die, it could be an abortion, it could be a stillbirth, or the baby can have congenital defects, mental retardation, and this can be easily solved with a treatment which is extremely cheap, which is penicillin. And but still, there's a lot of barriers to the health services. There's a lack of knowledge about it, and only now there starts to be more awareness and more interest. Countries are declaring national syphilis days to raise awareness. Some countries like Brazil are now promoting that trained nurses can prescribe and provide treatment for syphilis as a way to facilitate access to healthcare services instead of having the person come one day, get tested, go back to their home, then come another day, get treated, to just have like a one-stop shop. You get tested and you get treated same day, same morning, or same afternoon.
Are you optimistic heading into 2030 that a lot of these goals will be achieved?
I am optimistic by nature, but yes, because we have so many opportunities, and we just need to garner more social support, more knowledge, have better coordination, and work between the different sectors. Like the academia, there's extremely knowledgeable and interested researchers in the area of syphilis, for example. Governments are now also more interested. We do have the commitment for the elimination of mother-to-child transmission of congenital syphilis. Civil society starts to become more aware and also is advocating for better response. So hopefully, between all of us, we can make a difference and achieve those goals.
Dr. Monica Alonso, thank you for joining us.
Thank you. It was a pleasure.
I'm Elaine Reyes at UN headquarters in New York. Thanks for being a UN Insider. I'm Elaine Reyes at the United Nations headquarters in New York, and this is a special edition of UN Insider.
UN Insider serves as an important window for the global audience to better understand multilateral diplomacy.
It's very important for the media to cover the United Nations, to seek to understand and tell the story in ways that the average person in the street can understand.
I think it's very important that the media should contribute to conveying important messages about the reality of today's challenges.
UN Insider has come to the UN, and we at the UN are so grateful to have it here. It is the only dedicated TV program to what is happening in the UN, and it is reaching so many people with, as it says in its title, inside the UN stories.
Media plays an important role in providing objective information across the world.
We think that media has a strong power of uplifting, what we are trying to convey as messages as developing countries.
We need the mobilization of all peoples, of whole government and whole of society, and media can help us to be informed so that we also can make our part.
I think the media is fundamental to enable citizens across the world, first of all, to understand what is the rationale of having the United Nations. It's not that there is one place on planet Earth that will tell the rest of the world what to do. It is a much more complex story.